All right. Good evening, everyone, and welcome to the Medicare 101. This is part one of a four-part series. A couple of quick notes before we get started. I will be pausing during the presentation to see if anybody has questions. If you have a question, you're welcome to simply unmute at that time, or you're welcome to type your question into the chat box and I will address the questions at the pauses. Hopefully everybody got the email that I sent out about an hour and a half ago that included all of the handouts. However, Jessica has put in the chat box a link to the handouts as well, if you did not get or see the email yet. And I think that's it. If there's any difficulty hearing me, please let me know. Otherwise, let's go ahead and get started. So my name is Roma. I am with the Area Agency on Aging with the Pikes Peak Area Council of Governments. And I'm with the Senior Insurance Assistance Program. Through the Area Agency on Aging, the mission of that agency is to work with our 3-county region to develop programs and systems to help people stay in the community in their homes for as long as possible, and to advocate for services and programs. I am the coordinator for the local SHIP office, or the SHIP program, which is the State Health Insurance Assistance Program. This is a federally funded program that is available to anybody and everybody in every county of every state, at the very least through a toll-free telephone number in that state. The purpose of the SHIP program is to provide free and unbiased information, education, and assistance to anybody seeking information, education, and assistance regarding all things Medicare. So we do not sell or endorse any specific products or insurance companies, and we simply provide education and information on anything and everything regarding Medicare. As a SHIP program, our office actually serves 9 counties of Colorado. We've listed them here on the slide. You can reach us by calling either our local Colorado Springs number, or you can call us in any of the other counties through our statewide toll-free number, and you will be routed to either our office or to the office closest to where you're calling from. Again, this is a free program available to anybody interested in Medicare. Tonight, we are going to be talking about Medicare eligibility and enrollment and basic benefits. So we're going to be covering Medicare hospitalization and medical coverage, outpatient services. In future presentations, we will also be talking about Medicare supplements and advantage plans, which are the options that people can choose from to go with the original Medicare. We'll also be talking in session 3 about Medicare Part D, the prescription drug benefit. And in week 4, we will be talking about other insurance options that people may have to go with Medicare. But we're going to start with who runs Medicare. So Medicare, in order to be eligible for Medicare, you had to have either worked and paid employment taxes, or you're the spouse or family member of someone who worked and paid employer taxes. That information is tracked by Social Security, and it is Social Security that determines who is eligible for Medicare. Social Security also processes actual enrollments into Medicare. So to enroll in Medicare, you do have to contact the Social Security office. They can provide replacement Medicare cards, and they are available typically by phone, Monday through Friday from 7 a.m. to 7 p.m. in all time zones. Colorado Springs does have a local office, but there are other local offices spread out throughout the state. Once you're enrolled in Medicare, Social Security wants nothing to do with you. If you have any questions actually regarding the Medicare benefits and services, you would contact the Centers for Medicare and Medicaid Services, also known as CMS. I simply refer to them as Medicare. Medicare or CMS actually administers the program. They process the claims, they determine what benefits are going to be covered. They pay the providers directly. Medicare can be reached by toll-free number, 1-800-Medicare, 24 hours a day, 7 days a week, 365 days a year. There is no brick and mortar location for Medicare. They're only available through their toll-free number or through their website, medicare.gov. In order to be eligible for Medicare, you have to be a US citizen who is turning 65 years or older and had, of course, like I mentioned before, paid into the Social Security employment tax system through employment. You can also become eligible for Medicare based on being determined disabled through Social Security. If you are receiving kidney dialysis because you have end-stage renal disease, you can automatically become eligible for Medicare at any age. You can also become eligible for Medicare at any age if you've been diagnosed with Lou Gehrig's disease, also known as ALS, and any lawfully admitted resident alien who has resided in this country for at least 5 consecutive years is eligible to purchase Medicare. When should you enroll in Medicare? So these days, many people who become eligible for Medicare are not necessarily ready for retirement. So you don't have to be retired to enroll in Medicare, but there are certain enrollment periods that you do need to be aware of based on the fact that you become eligible for Medicare simply by turning age 65. Your initial enrollment period is just that. It's the enrollment period that you get from Medicare based on the fact that you are turning 65. That enrollment period is a 7-month window, and that window is the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and up to 3 months beyond the month of your 65th birthday. That is your initial enrollment window to enroll in Medicare without penalty. There are other enrollment windows that we'll talk about here in a second that would allow you to enroll in Medicare without penalty. But if you miss any of these enrollment windows and you're enrolling outside of initial enrollment or other special periods, you may be penalized for having enrolled in Medicare late. Other enrollment periods that we will talk about, special enrollment periods. This is an opportunity for people to enroll in Medicare without penalty beyond their initial enrollment. So if you did not enroll during that 7-month initial enrollment window, you can enroll during a special enrollment period if the reason you delayed enrolling into Medicare originally was because you were actively employed and had employer group health coverage through that employment. If that is the case, you can delay enrollment into Medicare until you quit working, and then you would have an extended period of time, an 8-month window to enroll in Medicare once the employment ends. If you miss your initial enrollment window and you don't qualify, or you miss your special enrollment period, you would still be able to enroll in Medicare at any year down the road during the general enrollment period or general election period. That is a 3-month window, January 1st through March 31st every year to enroll in Medicare. If you're enrolling in Medicare during a general enrollment period because you missed the other 2 enrollment periods, you enroll between January and March, but your Medicare doesn't go into effect until July. Typically, if you're enrolling during a general enrollment period because you missed the other enrollment periods, that is when penalties, late enrollment penalties, may be applied to what you pay for Medicare. And we will talk about that in more detail in a few minutes. This is what the Medicare card looks like these days. I still call it the red, white, and blue card. It will simply have your name. We'll have an 11-digit Medicare ID number, which is simply a random series of letters and numbers. And it will indicate when your Medicare Part A and Medicare Part B go into effect. And that's it. It used to be that you had to sign the Medicare card. It indicated whether you were male or female. This card has been simplified. It's become more secure because it no longer includes a Social Security number, which used to be your Medicare identifying number. and has been replaced with this just 11-digit random series of letters and numbers. If you are collecting Social Security, you may have gotten this card in the mail up to 3 months prior to the time you turn 65 or become eligible for Medicare based on disability if you're under 65. Important thing to remember when it comes to Medicare, make sure your mailing address is up to date at Social Security. Any correspondence that Social Security or Medicare needs to have with you through the mail will be based on that address that's on record at Social Security. If you're not sure if your address is up to date at Social Security, you can go to the Social Security website, ssa.gov, or you can call the toll-free national number for Social Security, which again is available Monday through Friday from 7 a.m. to 7 p.m. If you go online, you would be encouraged to create a My Social Security account. There are a lot of benefits to creating a My Social Security account. It is a very secure online account. It also helps facilitate the enrollment process. If you're trying to figure out how and when to enroll in Medicare, it would allow you to enroll in Medicare through the Social Security website. And just a quick note of caution, be aware of anyone who contacts you about a new Medicare card, a replacement Medicare card. Social Security will never ask you to give them personal or private information in order to give you a Medicare card. They already have that information. They should be providing it to you if they contact you. So if anybody's calling you to get that information, it is probably not a legitimate call. In the handouts that we provided for this presentation, I did include a couple of handouts for Social Security. One of the handouts, this one in particular, gives you a list of all the different types of services that you can get online through socialsecurity.gov. The other handout I included was information on how to create a My Social Security account. I also included a handout about creating a My Medicare account, which is a different type of account through a different website. So Social Security is, again, where you enroll in Medicare, but once you're enrolled, any questions or concerns you have about Medicare would actually go through Medicare. Again, My Medicare accounts are encouraged, but neither My Social Security or My Medicare accounts are required. So you can conduct business through those websites to an extent without creating an account, but there are some advantages to having those accounts, which I'll cover a little bit in more detail as we go. Any questions about any of that so far? Again, if you have any questions, you can simply unmute and ask your question, or you can type it into the chat box. All right, I'm not seeing or hearing any questions, so we will move on. So once you're enrolled in Medicare, we're going to talk about what Medicare covers and what it costs. And we're going to start with Medicare Part A. Medicare Part A, things to take into consideration before enrolling in Medicare Part A. If you are already collecting a Social Security income of any kind, whether it's retirement income, disability income, what have you. If you're collecting a Social Security income when you become eligible for Medicare for any reason, Social Security will automatically try and enroll you in Medicare. Again, if you are actively employed and have employer group health coverage, or you're the spouse of someone who is actively employed and you're covered under their employer group health coverage, you can delay enrollment into all parts of Medicare or one or the other parts of Medicare based on that employer group health coverage through active work indefinitely, or at least until that active employment ends. If you delay enrollment into Medicare based on active employment with employer group health benefits, again, you get an extended period of time to enroll in Medicare once that employment ends without penalty. So as long as you are enrolling during your initial enrollment period, where you enroll late based on having been employed with employer group health coverage, and that's why you delayed enrollment, there is no penalty for late enrollment into Medicare. For most people, Medicare Part A will be premium free, meaning it will not cost you a monthly premium. In order to be eligible for premium free Part A, you would have had to accumulated at least 40 quarters of work history. And again, that's tracked by Social Security. And that's the equivalent of 10 years of actual work history and paying taxes into the work tax system. That 10 years of work history can be accumulated at any time over the course of your lifetime. So if you worked, starting when you were 15 and you've worked nonstop since, the first 10 years of that work history, once it was accumulated, was enough to guarantee that you would have Medicare Part A at no cost when you became eligible. If you worked part-time jobs over the course of 20 or 30 years because you are primarily an at-home parent, as long as you worked a total of 10 years over the course of those 20 or 30 years, and you accumulated enough work quarters, again, you will have earned enough to become eligible for Part A at no cost. For those who do not have enough work history paid into the system, you can purchase Medicare Part A, but it's not cheap. Medicare Part A for people with less than 40 work history quarters for 2021 can be as high as $471 per month just for Medicare Part A. If you're not sure if you have enough work history, I would encourage you to contact Social Security or to create a Social Security account, and you'd be able to find that information, or simply call Social Security and ask them if you have enough work history to be entitled to Part A at no cost. Another way someone might be able to be entitled to Part A at no cost is through their spouse and their spouse's work history, as long as you and that spouse were married for at least 10 years. So if you don't have enough quarters based on your own work history, but you've been married to your spouse for at least 10 years, you may be eligible to get that benefit at no cost through that spouse. Again, Social Security is the one who tracks that work history and determines who gets what. So they are the only entity that will be able to tell you what you're eligible for and whether or not you'll get Part A at no cost. So what does Medicare Part A cover? Medicare Part A is basically going to cover any inpatient services that you may need. For most of us, that is going to be primarily inpatient hospitalization. So for inpatient hospitalization stays, Medicare Part A covers all inpatient hospital costs after an initial deductible. For 2021, the Part A deductible per admission is $1,484. So what that means is every time you're actually admitted to a hospital as an inpatient, you have to pay the first $1,484. Medicare Part A pays the rest, regardless of how much that is. That covers you up to 60 consecutive days in the hospital. Hopefully none of us will spend 60 consecutive days in the hospital, but 60 consecutive days is covered based on that initial deductible. If for some reason you had to be in the hospital for longer than 60 consecutive days, starting at day 61, Medicare would still continue to pay for that hospitalization, but they would start applying a daily coinsurance. What that means is they would continue to pay everything except for the daily coinsurance amount, which this year is $371. If for some reason you were unfortunate enough to be in the hospital longer than 90 days, you would start going into lifetime reserve days, and the coinsurance would go up to $742. This would be a very extreme and rather rare scenario for most of us. To be in the hospital for more than 3 or 4 days is usually kind of pushing it. They want to get you in and out as quickly as possible. 90 days is considered an actual benefit period for hospitalization. Because the inpatient hospital deductible is applied per admission and not per year, so it's not an annual deductible, it's a per admission deductible, you would have to have at least 60 days between the time you're discharged from the hospital to the time you're readmitted to a hospital before that deductible might be applied again. So if you were in the hospital, for example, for 3 weeks, they discharged you home, and a week later you had to go back into the hospital for some reason, because there was not 60 days in between the time you were discharged and readmitted, they would not apply a new deductible to that readmission to the hospital. But again, if you have that 60 days between discharge and readmission, that deductible would be applied to that second admission. There is no limit to how many times that could happen based on anything except for how many days are in the year. So if you have multiple admissions within a calendar year, you will have potentially to pay multiple deductibles. There is no maximum amount of time Medicare will pay for someone to be in the hospital, or how often someone can be in the hospital. Medicare Part A also covers psychiatric inpatient hospitalizations, but they do put a lifetime maximum on how many days they'll pay for psychiatric hospitalization of 190 days. But for medical stays, there is no maximum, there is no cutoff. While you're in the hospital, Medicare will cover any and all expenses that are medically necessary. What they will not pay for are convenience items primarily. So Medicare Part A, while you're in the hospital, does not cover personal convenience items such as your own telephone or TV. Fortunately, these days, most rooms come with that automatically at no extra cost. Medicare Part A will not pay for you to have a private hospital room unless it's deemed medically necessary and ordered by the doctor, or even in a situation where there might be no other space available and they have to put you in a private room, that would not count against you. Medicare Part A does not cover any of the first 3 pints of blood someone might need as a transfusion. Don't ask me why. I have no idea. But the first 3 pints of blood you might need are not covered by Medicare. Also does not cover private duty nurses or room sitters while you're in the hospital. And Part A does not cover what they consider self-administered drugs. Most drugs will be covered while you're inpatient in the hospital. But for example, if you are being discharged from the hospital, on the day of discharge, you are no longer considered admitted. But if it's taking them all day to get you discharged, and in the meantime, it has come time for you to take your maintenance medications, they're still going to give you or try and give you your maintenance medications. So they're going to come in the room and they're going to hand you a cup of pills and say, here, it's time for your medicine. But because it's day of discharge, you're no longer inpatient. If you take that cup and swallow those pills, that would be considered self-administered drugs, and they could potentially privately charge you for that outside of what Medicare pays. Just something to be aware of. Hopefully you won't run into that scenario, but do be aware of it. Another benefit of Medicare Part A is skilled nursing care. For skilled nursing care, which primarily would involve rehab or recovery after hospitalization, Medicare Part A will typically cover up to the first 20 days of any inpatient rehab skilled facility stay at 100%. However, the caveat to that is Medicare does require that you have at least 3-day hospitalization as an inpatient before you're discharged to a skilled facility for rehab or recovery in order for them to cover it. So the key factor here is you are required to be in the hospital for 3 days or longer as an inpatient before you're discharged to a skilled facility for rehab or recovery in order for Medicare to pay for that skilled facility for rehab or recovery. If you meet that criteria, again, Medicare will pay 100% for the first 20 days of that skilled facility stay. If you're there longer than 20 days, starting at day 21, Medicare will continue to pay everything for that continued skilled facility stay for rehab or recovery, everything except for $185.50 coinsurance for 2021. So the first 20 days would be covered at 100%. and days 21 up to the maximum of day 100, everything would be covered except for $185.50 per day. Now that $185.50 per day is considered a co-insurance. Medicare will pay all or part of up to 100 consecutive days at a time in the skilled facility. If for some reason you are still in a skilled facility on day 101, at that point, Medicare no longer cares why you're in the facility because they will cut off benefits completely. The whole point of Medicare paying for inpatient skilled facility care for recovery or rehab is just that, for recovery and rehab, or rehab so that you are recovering. And Medicare has determined that if you have not recovered enough to go home, even if it's going home with additional home care, then you are likely not going to be able to go home anytime soon. And after 100 days, your continued stay in a facility starts to be considered what they call custodial or long-term care. At that point, Medicare no longer considers that stay medically necessary. And Medicare only covers things that they consider medically necessary. So if you are still in the facility on day 101 and Medicare benefits cut off completely, you would be looking at some, primarily some limited options. You can private pay to continue your stay in that facility. You may have purchased long-term care insurance in the past that would help cover the cost of that long-term facility stay, or you may qualify for Medicaid to help cover the cost of that long-term care facility stay. Again, Medicare pays all or part of up to 100 consecutive days at a time, inpatient skilled facility care, but they put no limit to how often you can have those 100 days. So there is no maximum how many times you can use this benefit, but the same guidelines for hospitalization apply to skilled care. You would have to have at least 60 days from the time you're discharged from a skilled facility to the time you're readmitted to a skilled facility before that 100-day benefit period renews. And you would start over with another 20 days covered at 100%, and the other 80 days paid everything except for the co-insurance. If you have less than 60 days between discharge and readmission, when you go back into the skilled facility, you would start the count of days where you left off when you were initially discharged. So you would be in the same 100-day benefit period. It would not be starting over with less than 60 days between discharge and readmission. The last benefit available through Part A is going to be home health care benefits and hospice benefits. Home health care benefits and hospice benefits typically are covered at 100% by Medicare, but they do require that a doctor certify your eligibility for those benefits. And not only do they have to initially certify that eligibility, they have to continually certify that eligibility every 90, 60, or 90 days to Medicare to confirm that you are still eligible for either of those benefits. For those benefits, deductibles do not apply. Again, most services are paid at 100%, though the one exception might be that for home health care services, if that home health care agency is providing you with a wheelchair or a hospital bed or a walker or something like that, that would be billed under a different part of Medicare, and you may only be covered at 80%. There are some limitations to both of those benefits. But again, the key to any benefit of Medicare is medical necessity. So as long as a doctor determines that you are eligible, you meet the criteria, and your need is medically necessary for either of those benefits, Medicare should pay for them. There is no limit to how long you can receive either of these benefits, as long as the doctor continues to certify that you are eligible for them based on the Medicare criteria. So I do see we have a couple of questions in the chat box. First question, I'm going to retire at 60 from my employer. Will no longer have employer provided medical insurance, but will have money deposited in the HRA by the employer. Not going to begin Social Security until age 70. Will I need to enroll in Medicare at 65 in order to avoid penalties? The answer is yes. Absolutely yes. The only excuse Social Security will allow for not enrolling at Medicare when you first become eligible is if you are actively employed and have employer group health coverage through that active employment. Regardless of whether or not your employer coverage continues beyond employment, the key to that ability to delay enrollment without penalty is active employment. So once you are no longer actively employed, you would want to enroll in Medicare. So yes, you would want to enroll in Medicare at 65 to avoid penalties. And then the next question is, what does a pint of blood cost? I haven't had anybody ask me that question in a really long time. And my answer is still, I have no idea. I don't even think I want to know, honestly. On the other hand, I can tell you that hospitals are now required to provide cost information for the services that they may offer through a hospital. It's part of a price transparency initiative by Medicare. So you might be able to go to any hospital's website and actually look up the cost of a pint of blood. That initiative, price transparency initiative, went into effect at the beginning of 2021. And hospitals are supposed to have that information available to the public. And it may not tell you the cost of all services, but it should give you the cost of a pint of blood if you're really curious. Why Medicare doesn't cover the first 3 pints of blood, I honestly have no idea. They will start covering blood at pint number 4, but for some reason they don't cover the first 3 pints. Any other questions about Medicare Part A? All right. Here we go. Oh, I got one more question in the chat. Does my wife need to apply for her own Medicare when she turns 65, or can she be on my Medicare? So the bottom line is, if someone has worked, paid into the system, and has earned the ability to enroll in Medicare on their own work history, they will be enrolled on their own work history. The only time someone would be enrolled in Medicare based on someone else's work history is if that person does not have enough work history of their own. So if there is the ability for her to enroll based on her own work history into her own benefit, Medicare and Social Security will require that she do it that way. So it won't even be an option unless somebody is not eligible for benefits on their own work history. All right. If there are no other questions, let's go to Medicare Part B. So Medicare Part A was for inpatient hospitalization, and most of us will be able to get that at no cost. Medicare Part B is a little bit different. Again, things to take into consideration: if you are already collecting a Social Security income of any kind for any reason, when you become eligible for Medicare, Social Security will try and automatically enroll you in Medicare. But again, if you're actively employed, you have employer group health coverage, you can delay that enrollment. Or if you're the spouse of someone who's been actively employed and you're covered under their employer group health coverage, you can also delay enrollment into Medicare until that employment ends. And then you would have up to 8 months to enroll in Medicare without penalty. For Part B benefits, pretty much everybody has to pay for Medicare Part B. There is no earning Part B at no cost. So everybody pays a premium for Part B, and that amount can vary based on income. There are some scenarios where you may be required or want to enroll in Part B. For example, if you are looking at getting into any of the other types of coverage to go with Medicare, and I'm sure everybody's been bombarded with the TV commercials and perhaps the junk mail and emails advertising all of these different kinds of insurance options. You have to have both A and B to enroll in a Medigap or Medicare supplement. Medigap and supplement are two terms for the same thing. You have to have both A and B of Medicare to enroll in the Medicare Advantage plan or Medicare Part C. Excuse me. And if you're retired military and you become eligible for Medicare and you want to maintain your TRICARE benefits, you are required to enroll in Medicare A and B. If you are a veteran and you primarily use the VA system for your health care, I get a lot of veterans in that situation ask me if they need to enroll in both A and B. And my answer is always probably. VA is not considered employer coverage. Again, that's the only excuse Social Security allows for not penalizing people for late enrollment into Medicare. So you always have the option of whether or not you want to enroll in any part of Medicare. No part of Medicare is required by law. It's all optional. We work and pay taxes for these benefits, but nothing in the law says we have to use these benefits. However, if you choose not to use them initially, but down the road you decide that you want them, that's when penalties come into play. So if you don't get them when you first become eligible, which is your option, you are allowed to enroll in these benefits at any year down the road during that general enrollment period. But by doing that, you will ultimately pay more in the form of late enrollment penalties for delaying enrollment. And the same applies to VA and veterans who use the VA system. But again, and I keep stressing this point over and over, just so it sinks in, if you're actively employed with employer group health coverage, you can delay enrollment into both parts of Medicare. Now, many people and even Social Security will probably encourage you to enroll in Part A, even if you are still actively working with group coverage, simply because Part A is at no cost. There's no downside to enrolling in Part A necessarily. If you enroll in Part A, because it has no cost, even if you're still actively employed, keep in mind that Part A benefits will typically become secondary to Medicare or to your employer coverage, I'm sorry. So if you have employer coverage, that's your primary insurance. And if you enroll in Part A as well, any hospitalization stays after the employer coverage, Part A would become secondary payer. You could enroll in Part A and B and still be actively employed with employer group coverage. There is less advantage to doing that simply because you have to pay a premium for Medicare Part B. And so it's basically paying two premiums that may not provide you any additional benefit if services are received. Or you can delay enrolling in both parts of Medicare and just delay the whole process and coordination concern until you actually quit working and lose your employer coverage. Again, if you delay enrollment, that is considered a special enrollment period based on active employment, and you get an extended amount of time to enroll in Medicare when that employment ends. But if you miss both your initial enrollment or your special enrollment period to enroll in Medicare, the only other time you can probably enroll in Medicare down the road would be during the general enrollment period, which again is January 1st to March 31st each year. Coverage wouldn't start until July 1st. So how much does Medicare Part B cost? Well, for most people in 2021, the Part B premium is $148.50 per month. However, I mentioned a few minutes ago that the Part B premium may be different based on income. So premiums are increased if you have a higher income for many people. If you are collecting a Social Security income when you become eligible and enrolled in Medicare, Social Security will automatically start deducting that Medicare Part B premium from your check the month your Medicare goes into effect. If you are not collecting a Social Security income when you become eligible for Medicare because you intend to delay enroll in collecting income until you reach full retirement age or what have you, you're going to reach the maximum retirement age, then you would be billed directly for that Part B premium. And you can arrange to pay that either quarterly through a paper bill, or Social Security has now set up an online payment system where you can have it electronically drafted out of your bank account every month. If you do incur a late enrollment penalty because you did not enroll in Medicare during your initial enrollment period, you didn't have a special enrollment period, you're enrolling during the general enrollment period, the way the late enrollment penalty is calculated, and again, it's only calculated for Part B because Part B is the part of Medicare that most of us pay for. That penalty is going to be calculated at 10% of the Part B premium for every full 12-month period that you delayed enrollment and didn't have either employment coverage as your reason for that delay. That 10% or that 10% penalty per 12-month period does accumulate over time. So if you wait 3 years to enroll in Medicare and you didn't have a special enrollment period to take advantage of, so you're enrolling during general enrollment period, that 10% is going to accumulate times 3 years. So now you're looking at a 30% penalty. That 30% will be multiplied by whatever the Part B premium is 3 years from now, whatever that comes out to. So 30% times $148.50, whatever that comes out to is going to be tacked on top of the Part B premium at that time forever. So that penalty is tacked on top of whatever the premium is at the time you enroll every month forever and ever and ever. Part B penalties never go away. So that is something to keep in mind because it may not add up to a lot initially, but over the course of your entire lifetime, it can add up to quite a bit of money. For Part B services, there is an annual deductible. Again, remember Part A services have a deductible, but it's based on admission. So it's a deductible applied per admission. The Part B deductible is annual, one time a year, and it's literally a drop in the bucket compared to most deductibles for other coverages in this point in life. $203 is the Part B annual deductible for 2021. Once that deductible is met, meaning you have to pay out of pocket the first $203, once that deductible is met, then Medicare will pay for most Part B services at an 80-20 split. Simple as that. Again, I mentioned Part B premiums may be different for different people based on income. That is called the Income Related Monthly Adjusted Amount, or IRMA for short. And basically what that means is Part B premiums are means tested, meaning the more you make in income, the more you may have to pay in Part B premiums. The thresholds for people with higher incomes to worry about: for a single person filing individual income tax, the threshold for 2021 is $88,000 a year. So if you have an income of $88,000 a year or higher, you may be paying a higher Part B premium. There are actually a total of 6 different thresholds. And if you go into the higher thresholds, or the higher the threshold you go into, the higher the Part B premium you may end up having to pay based solely on income. They also have a threshold for couples filing jointly of $176,000. Now, all of these numbers that I've mentioned, the Part B deductible, the Part A deductible, the Part B premium, the coinsurance for skilled care, all of these numbers change on an annual basis. And typically when I say change, I mean increase. May not be a large increase. So for example, the Part B premium in 2020 was $198. In 2021, it was $203. So it may not go up a lot, but keep in mind that those costs do go up every year. Same with these income thresholds. We don't have the numbers for 2022 yet, but keep in mind the way the IRMA income increases, or the Part B premium increases, are calculated. are usually based on income tax information from the IRS. So Social Security is going to look at the most recent complete income tax filing that you may have submitted, which is probably going to be 1.5 or 2 years old. So they're going to base whether or not you have to pay a higher premium on information about income you may have had in 2019. If for some reason you had a higher income in 2019 and you get a notice from Social Security that you may have to pay a higher Part B premium, but in 2021 you've retired, you no longer have that level of income, don't feel like you're stuck paying that higher premium, because you can appeal that decision simply based on the fact that your income is no longer at that level. So you wouldn't be stuck paying that higher premium if you no longer have that higher income. So something to keep in mind, and any of that information would be outlined in any notice you did receive from Social Security about the potential to have to pay a higher premium. All right, so that is Part B costs. I do have a couple of questions real quick that I will address before we move on. So first question is, how is your income evaluated to determine your Part B premium? Is it reevaluated each year? Hopefully I just answered that question regarding the IRMA and how they look at that and how they get that information determined. Again, it's based on complete IRS tax filings. Second question, what documents would be required once you quit employment and the company's medical insurance ends and you're ready to sign up for Medicare? So if you delayed enrollment into Medicare, A or B or both, because of active employment with employer group health coverage, there is a form that either you can download from Social Security or your employer should be able to download from Social Security, because it's something that the employer typically fills out that simply states that you were actively employed and had health coverage through that employment from a start date to an end date. It's a specific form, and I can't think of the form number off the top of my head. But it's typically a form that the employer fills out and submits to Social Security for you. If for some reason that's not a possibility, so either the employer no longer exists or the employer refuses to do it for you, Social Security will accept attestations where you can fill it out yourself and tell them that you were insured from this date to this date, but they will try and verify that with the employer. So it is a form that needs to be filled out primarily by the employer. And again, you can go to the Social Security website, ssa.gov, and find that form and just type in the search box, proof of employer group health coverage is what I would type in to get that information. Another question, does a reverse mortgage impact the means tested premium amount? The answer is no. They only look at adjusted gross income for that means testing. And it's my understanding that reverse mortgages is not necessarily considered income. And then are all the slides in the handouts? Yes, I did include a copy of these slides in the email that I sent, and they are available and posted on our website as well. Any other questions before we move on to what Part B covers? Okay. So now that you have Medicare Part A, you're paying for Medicare Part B, what does Part B cover? So Medicare Part A covered primarily all inpatient services. Medicare Part B primarily covers all outpatient services. So that includes doctor's visits of any and all kinds, primary specialists, what have you. Part B covers all your lab and x-ray work. Medicare Part B covers medical, surgical, and anesthesia services. And Medicare does cover medical second opinions. Again, no part of Medicare covers any of the first 3 pints of blood someone might need, but Medicare will start covering blood at pint number 4. Part B covers emergency ambulance transportation, covers your annual vaccine, such as the flu shot, hepatitis B, pneumonia shot, covers the shingles vaccine. However, Part B only pays for the shingles vaccine as far as having it administered. So for example, the nurse actually injecting it into you. Part B covers all your outpatient physical, occupational, and speech therapies, covers all your durable medical equipment, such as oxygen, walkers, wheelchairs, that kind of stuff. And there is some limited coverage for other services as long as medical necessity criteria is met, such as optometry, podiatry, that kind of stuff. Things that are not covered by Medicare Part B are going to be routine annual physicals, routine foot care, hearing aids or the fitting of them, not covered by Part B, routine eye exams and the glasses associated with them, not covered by Part B, and even in medically covered or Medicare covered eye services, if you get a refraction of your eyes where they shine the bright light and then you can't see for a couple hours, that would not be covered by Medicare in any circumstance. Currently, Medicare does not cover dental in any way, shape, or form, does not cover anything considered cosmetic because it wouldn't be considered medically necessary. Now, having said that, there are some exceptions to these rules, kind of. So again, Medicare does not cover routine annual physicals. So if that's something you're used to receiving every year, that is no longer a benefit that Medicare has ever paid for. What Medicare does pay for instead is called a Welcome to Medicare Preventive Visit. The Welcome to Medicare Preventive Visit is basically going to be an in-depth conversation with your medical provider to establish your medical history, your health, your mental health history, social history, all those kinds of things, and to try and determine if they should suggest or encourage you to get any other preventive services in the near future. It is not a physical, it's a conversation. There is no actual blood work drawn, there's no getting on the treadmill, nothing like that. The Welcome to Medicare Preventive Visit that Medicare will pay for is a use it or lose it benefit. Right now, you have up to 12 months to take advantage of it. If you don't take advantage of it within 12 months, then you lose your ability to use it. However, regardless of whether or not you take advantage of that Welcome to Medicare Preventive Visit, Medicare will allow you to receive an annual wellness review each year. Again, this is simply a in-depth conversation with your provider about your health history for the previous year, your mental health history, your social history, etc. Medicare has really jumped on the preventive service bandwagon because they have finally figured out that it is more cost effective to prevent illness and disease than it is to treat it. So Medicare has worked very diligently for the past 10 years or so to not only start including preventive service coverage, but they've worked to make sure that by 2020, they covered all preventive services available under the Medicare benefits at 100%. And they accomplished that. However, they do still continue every year to add additional services to the list of preventive services that they will pay for. So there's a huge, huge long list of services Medicare covers under preventive benefits. The most effective way to get that list of preventive services is by opening up the Medicare New Handbook. If you already received Medicare, you would have gotten the Medicare New Handbook in the mail by now. If you are very new to Medicare or becoming eligible for Medicare in the near future, you would not have gotten a Medicare New Handbook this year. But if you enroll in Medicare, you will get one automatically next year. If you would like to view the Medicare New Handbook, I actually do have some that we received from Medicare at our office, and I'm happy to make those available to you. You're welcome to come pick them up at our office at any time. Or you can go to the Medicare.gov website and download the handbook as a PDF or print it out. In the handbook, there is about a 20 or 25 page section that goes into significant detail about preventive services. So it tells you all of the services that they cover at 100% as a preventive measure. They describe the services and how often you can get them. And they're always identified by having a little blue apple symbol next to those descriptions. That section does detail and describe more than just preventive services, but the ones with the little blue apple are considered preventive. And that's Medicare Part B benefits in a nutshell. Any other questions before we move on from that? I'm not hearing any and I'm not seeing any. Okay. All right. So that is enrolling in Medicare. That's eligibility for Medicare. That's what Medicare or A and B cover. Medicare Part A and Part B together are referred to usually as original Medicare benefits. So most people can have either original Medicare benefits as their primary coverage, or they can have other benefits such as a Medicare Advantage plan as their primary coverage. We will discuss all of that in detail more next week. There are financial assistance programs available to help cover some of the costs of Medicare for people who have limited or low income. These programs are called Medicare savings programs. These are federally funded programs. If you qualify for these programs, they can help pay the Part B premium for you. What that means is instead of Social Security deducting that $148 out of your check every month, the state of Colorado would pay that premium for you and you would start getting that $148 back every month. At a lower income level, it may also help with the Medicare Part A and Part B deductibles and co-insurances. If you apply, if you're eligible, apply and approved for Medicare savings programs, you would automatically also be approved for help with Part D costs, financial assistance for Part D benefits, the prescription benefits. But you must apply for these programs if you are eligible and want to get them. To apply for Medicare savings programs, you actually have to go through the local Department of Human Services and do a Medicaid application. Even though technically these programs are not Medicaid programs, they're federal programs, the government has decided that the easiest way to apply for these programs and process the applications and eligibility is through the local Medicaid service office. If someone is already on a government program such as SSI, Supplemental Security Income, if you are already on long-term care Medicaid benefits, if you are eligible for old age pension benefits, then you would automatically become eligible for this kind of assistance. But if you're not automatically eligible based on one of those other programs, you would have to meet income and asset guidelines to determine your eligibility. There are 3 different levels of Medicare savings programs that someone can qualify for: QMB, SLMB, or QI1. QMB stands for Qualified Medicare Beneficiary. SLMB is Special Low Income Medicare Beneficiary, and QI1 or QI is Qualified Individual. Income limits for a single person at the lowest income limit program, your maximum income would be $1,094. That would be pre-deduction or gross dollars. For a couple, it would be $1,472 per month. $1,496 would be the maximum low income limit for a single person to be eligible for any of these programs. Again, these are pre-deduction gross dollars per month. Asset limits. Asset limit would be for a single person $9,470. And that would be in liquidatable assets, checking, savings, investments, IRAs, 401ks, all of that would be added together to determine if you are within or under that asset limit. These numbers do change every year as well. Usually not changed until January or February each year. But they do go up a little bit each year based on the cost of living. If anybody has any questions or is interested in getting more information about any of these programs, our office does help with these applications and we can help determine if you're eligible or answer any questions you might have about these programs. And that is about it for tonight. Let's check to see if we have any last minute questions. Again, if you have questions, you can simply unmute and ask your question or type it into the chat box. Okay, so I have a question. Could I give an example of a 2 or more year penalty? So I'm assuming you're talking about the Medicare Part B penalty, and how that is calculated. If you have accumulated a Part B penalty, what that means is you did not enroll in Medicare during your initial enrollment period when you first turned 65. You did not enroll in Medicare because you were actively employed and delayed enrollment beyond your initial enrollment period, and you had to enroll in Medicare. The only other time you could have enrolled in Medicare was during the general enrollment period, which again is January 1st through March 31st each year. If you enroll during that time frame for those reasons, your benefit does not go into effect until July 1st of that year. Medicare is going to look at how many months you went without Medicare outside of your initial enrollment and were not actively employed as your reason for not enrolling. And for every 12 full month period, they're going to add 10% penalty. So if you waited 2 years to enroll and you weren't actively employed, if you waited 5 years to enroll and you weren't actively employed, for every 12-month period, they're going to add 10%. So after 2 years, it's 20%. So say you were eligible for Medicare 2 years ago. You didn't enroll for whatever reason, you weren't employed, and now you want to enroll in Medicare in January. They're going to look at the last 2 years, determine that you didn't enroll, you weren't actively employed. They're going to accumulate 2 years worth of penalty, or 20%. When you go to enroll in Medicare in January, they're going to see whatever the premium is in January. So we'll use $148.50, for example. They're going to take $148.50 and multiply it times 20%. And whatever that calculation comes out to is going to be tacked on top of the $148.50 per month every month, forever. And the longer you wait to enroll, the higher that penalty gets, because you wait 5 years, it's 50%. You wait 10 years, it's 100% of whatever that premium is the year you enroll. So every year that premium increases, every year you accumulate another 10% in penalty. So the longer you wait, the higher penalty you pay, and you pay that forever. So hopefully that helps answer your question. If it does not, you're always welcome to email me, and we can talk about it in more detail. Another question, my last day of employment is on 12/31, and the first day of retirement is on 1/1. Do I need to enroll in Medicare during the open enrollment period during October 15th through December 7th, which is getting ready to come up here real quick? That annual enrollment period, which is coming up and starts October 15th and runs through December 7th, that enrollment period is only for people who are already in Medicare and are looking at their options for either Advantage plans or Part D coverage for next year. So if you are not already enrolled in Medicare, you do not have to worry about this upcoming annual enrollment period, October 15th through December 7th. That is only for people who are already on Medicare. Once you're enrolled in Medicare and you decide whether or not you're going to get an Advantage plan or a Part D drug plan if you need one, next year you are probably going to want to pay attention to this enrollment period of October 15th through December 7th and see if you need to make any changes. But if you're not enrolled already in Medicare, you do not need to worry about this enrollment period. Another question, if a person needs home health assistance for bathing and light housekeeping, does Medicare A or B pay or assist with these costs? Unfortunately, the answer is no. Those services are considered non-medically necessary and would not be a benefit of Medicare. For home health care, Medicare will pay to have a medical professional come in and do physical therapy with you. We'll have a nurse come in to check bandages or wounds, or if you're on dialysis, whatever. It has to be a medical need for Medicare to pay for someone to come into the home and provide care. Anything that's considered housekeeping, personal needs like bathing and dressing are not a benefit of Medicare in and of themselves. If someone has multiple chronic needs, and because of those needs, they also need help bathing or dressing, Medicare may allow that to be included in the services. Light housekeeping, probably not even in that scenario. So again, unfortunately, bathing, dressing, light housekeeping are not benefits of Part A or Part B. Looks like last question. If I work until 66, will my annual premium be higher for all future years than if I had applied at age 65? So Medicare premiums increase every year based typically on cost of living increases. Whether you start paying the premium at 65 at $148.50, or you start paying that premium at 66. If you start paying the premium now at $148.50, when the premium changes next year, that's what you're going to start paying next year. So every year that premium increases, and it increases for everybody. So it doesn't matter what you start paying the premium at when you start or enroll in Medicare, your premium is likely to increase every single year, just like everybody else. So it's really kind of a moot point as to whether or not you wait, because no matter what, you're going to pay the premium for the given year, whether you enroll today or 10 years from now. Whatever that year's premium is of what you're going to pay, and when it changes the next year, that's what you'll pay the next year. So hopefully that answered that question adequately. If you still have other questions, or you think of questions after this presentation is over, you again are welcome to contact your local SHIP office. That's us. We are available Monday through Friday, typically from 9 a.m. to 4 p.m. by phone. Again, you can call the toll-free statewide number, which will route you to the SHIP office closest to wherever you're calling from whatever county you're calling from. You can always go to the website, the SHIP TA Center or shiphelp.org, and it will, you can search for the SHIP office closest to you in your state. Quick note, our office is also the local Medicare, Senior Medicare Patrol or SMP office, which is the Medicare Fraud and Protection Department, and volunteer education. We provide information, education, and volunteer opportunities to help educate and inform people about Medicare fraud, Medicare and Medicaid fraud and abuse, scams, all that kind of stuff. We're always looking for volunteers. Anytime anybody has anything to report, such as suspicious activities or claims being submitted to Medicare that for services that you never received, that's the program that you would report that to. We're always happy to help, and we're always looking for volunteers. If you want more information, you can call the statewide SMP hotline, 800 number is provided, or you can visit the national website, the smpresource.org, for more information and to find the program nearest you. Again, we are always looking for volunteers for our programs because we are government funded, grant funded. That allows us to charge no cost for our services. So all of our services are free. So we are always looking for volunteers to help us fight the good fight. And volunteer opportunities are available locally. All training is done locally as well. And that is all I have for you guys tonight. Hopefully you will join us next week for part 2, where we will discuss other insurance options, Medicare supplements, also known as Medigap, and Medicare Advantage plans, also known as Medicare Part C, in detail. Again, if you have any other questions, you're welcome to email me at seniorinsure@ppacg.org. You're welcome to call our office. We have a total of 5 full-time counselors and a part-time volunteer who are ready and willing to assist you. We serve 9 counties of Colorado, so if we don't call you back right away, please be patient. This is getting to be our busiest time of the year because we will be assisting hundreds of people during open enrollment. Emails are always a good idea. If you want to email your questions or concerns, please do so. You'll usually get a much quicker response by email than by phone. And I think that's it. I appreciate you guys joining us tonight. Again, we hope to see you next week. And unless there are any last minute questions, I wish you all a good night. Please email us or call us if you have any questions. All right, I think we're good. Good night, everybody.